My name is Sophia Silao, and I am the Program Officer of the Special Projects Fund at the NYHealth Foundation. Welcome to our webinar on public guardianship. Today's session is part of the Foundation's effort to inform healthcare policy and practice by shining a light on systemic barriers that prevent communities from accessing the care they need and that they deserve, and highlighting the community-informed practices that move us towards the goal of equitable and high-quality healthcare for all New Yorkers. First, a few housekeeping items. Audience microphones and video cameras have been turned off to ensure optimal audio and visual quality for today's session, but we want to hear from you, our audience. So please drop your name and organization in the chat to let us know you're out there. And we'd also love to know what you think. Drop your questions and your comments in the chat as well. Now, this webinar is being recorded, and a recap of the session along with copies of the slides will be posted on our website after today's session. Closed captioning is also available for those who need it. So let's begin. Guardianship, more commonly known as conservatorship, is a legal process used to support decision-making for an individual who has diminishing capacity or can no longer make or communicate safe or sound decisions about their care or about their property. Guardianship can help vulnerable individuals live out their lives with dignity and choice, but when done improperly can result in financial exploitation and sometimes mental, physical, or emotional abuse. It's a complex issue that will affect millions of individuals. Britney Spears and her struggle to gain her independence from a conservatorship is a very public example of the pitfalls of guardianship. And she was a public figure with significant resources. But for patients with limited resources and without family support, the challenges are even greater, leaving them more vulnerable to fraud or undue influence. And every state has its own guardianship laws. New York State, for example, does not offer a single public guardian program for low-income people. Instead, it relies on a web of services from adult protective services, community guardian programs, nonprofits, and publicly assigned attorneys. We're joined today by three amazing women from Project Guardianship, an organization whose mission is to provide direct services, advocacy, and care support to older adults and individuals living with disabilities and mental illness. Between the three of them, they have decades of experience advancing social justice, and their credentials are too extensive to list in its entirety. But trust me when I say they are impressive. Kimberly George is the president and CEO of Project Guardianship. She's held leadership positions at numerous organizations that advance the rights and dignity of marginalized individuals, including religious minorities, low-income and communities of color, older adults, and people living with disabilities and mental illness. Azaleea Carlea is their director of policy and advocacy. She has extensive litigating and policy advocacy experience and has served in the office of U.S. Senator Kristen Gillibrand. And Deena Schwartz is their director of New York State Guardianship Initiatives. She's been working on guardianship and issues affecting older adults for a decade. Deena has led large groups of multidisciplinary stakeholders to help shape community responses to complex elder abuse and worked as an attorney with adult protective services. Welcome, 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 Kimberly, Azaleea, and Deena. We're really happy that you could join us today. So guardianship is a very complex topic. And before I pass the mic on to you in a minute to talk about it and about your work, I do want to remind the audience to send in your questions via the chat. We will have time at the end for Q&A, and I will try my best to include all of your questions into our conversation. So Kim, Azaleea, and Deena, the floor is yours.
Thank you, Sophia, for the introduction, and to the NYHealth Foundation for hosting this webinar and giving us the opportunity to share information about Project Guardianship's work. You can put on the next slide. Project Guardianship's mission is to provide person-centered care for older adults and individuals living with disabilities and mental illness who need help making decisions. We also work to transform the systems that support these populations to ensure safety, promote independence, preserve dignity, and advance racial and social justice. Next slide. Project Guardianship was founded in 2005 to fill a gap in the justice system that left unprotected a population of largely low-income aging adults and people with disabilities who lack family and other supports. As Sophia mentioned, New York State does not have a public guardian. What this means is if a person has no family member or friend to be their guardian, a private practicing guardian can be appointed, but they are paid out of the person's income and assets. So if a person has no money, there's little incentive for a private guardian to serve. This is especially true if the person's case is complicated. Often, private guardians do not have the time or training to untangle complicated cases with overlapping issues, such as involving property theft, housing instability, mental illness and medication noncompliance, and other complex service needs. The law creates a system where anybody could be subject to a guardianship petition, and the courts are required to appoint a guardian when needed, but there are not enough good guardians to appoint. Since its founding, Project Guardianship and other nonprofit guardianship programs throughout New York State have demonstrated that nonprofits centered on human dignity can enable people with little resources and support to live more safely and independently while also saving public dollars. I'm now going to turn it over to Deena to talk briefly about what is adult guardianship.
Thanks, Kimberly. So just to make sure that we're all on the same page about guardianship, and I think we all can always use a refresher, including myself. Guardian is a person or an entity that's appointed by a court to make decisions for a person who can't meet their needs and is at risk of harm. Perhaps someone's living in an unsafe environment, is unable to follow through with necessary medical care, doesn't have the ability to keep up with bills and rent. Maybe they're at risk of losing their home. Sometimes there's abuse, neglect. The list really can go on about the reasons why someone might need a guardian. A judge generally must find that the person is incapacitated to appoint a guardian. There is also an option to consent. That's not as common, but I just wanted you to know that that is possible. A guardian is given powers to make decisions for a person. So these powers under the New York State statute are meant to be tailored to the needs of the person. So the powers of the guardian are only for those things that the person cannot manage themselves. So for example, let's say someone can't manage their income and they're forgetting to pay bills, they're at risk of losing their home, but they can still take care of all of their other things, their daily activities, their food, etc. The guardian may be given powers to enter into contracts, manage income, but anything related to personal care might be left to the person. So those with a guardian retain all decision-making abilities not specifically given to the guardian. And also, guardianship isn't necessarily permanent, which I think is sometimes something that's misunderstood. It is the case that when someone's appointed a guardian, they may need one indefinitely, but the powers can always change. If the guardianship's no longer necessary, you can get an order from a judge to end the guardianship. And since guardianship does take away the ability for a person to make some of their decisions, it's important to know that New York State law considers it the last resort and the last aid in meeting someone's needs. So you really need to make sure that every other option's been explored first, like powers of attorney, healthcare proxies, community resources, informal financial arrangements, lots of possibilities. And I know I've mentioned a judge multiple times. You have to go to court to get a guardian. It involves filing papers, having a hearing. It's often time consuming. It can be expensive if you hire an attorney. And there's not a ton of guidance to do it on your own. There's almost no free legal services to assist. The one other thing that I wanted to mention before turning it over to Azaleea is that we're talking about what's known as Article 81 guardianship. And that comes from the New York State mental hygiene law. There is another type of guardianship for adults that's known as 17A guardianship that requires a diagnosis of a developmental or intellectual disability. There's no choice in powers. Those kinds of guardians can make all decisions. It doesn't have the flexibility that Article 81 guardianship for adults. does. So I just wanted to differentiate between the two because Project Guardianship solely works on Article 81. So I'm going to now turn it over to Azaleea. Oh, no, I'm sorry. I'm turning it over to Kimberly to talk about our specific model.
I'm going to jump in here. Thanks, Deena. Project Guardianship offers a comprehensive guardianship provision. Each client that we serve has a multidisciplinary team consisting of an attorney, a case manager, a finance manager, a benefits coordinator, and a housing specialist. And we keep our client to staff ratios pretty low. Each client, each case manager, I should say, has no more than 25 clients to serve. We also specialize in keeping people in their homes and out of institutions, as well as moving people back home. Too often people get stuck in institutions after an illness or an injury because there's no one to make the necessary arrangements to get them home. Unfortunately, COVID proved that these institutionalizations and the efforts to reduce them can literally be life-saving. We also have special expertise in making end-of-life decisions in accordance with the law and in accordance with the client's wishes. We often put in place measures that increase our clients' comfort and prevent painful and excessive interventions. We serve as guardian to clients regardless of their ability to pay. And we have the capacity to provide services for the court's most complex cases. We're also willing to serve as co-guardian of personal needs with family or friends who might not be able to serve without extra support due to complicated situations like property management. Lastly, we also provide research and recommendations for a better guardianship system and advocate for more equitable responses to providing services for people who need protective arrangements. Next slide. Just some demographics on our clients. As I mentioned, we strive to keep as many as possible out of institutions. This not only saves public dollars, but it promotes the health of our clients and is most often what they strongly desire. 77% of our clients are over 60. Our clients are predominantly female. The majority of our clients are minorities. While half are white, the majority of the white identifying clients identify as Latino or Hispanic. And lastly, almost all of our clients are poor and living on very small incomes. Next slide. Over half of our clients have diagnosed mental illness or cognitive decline. Many more have undiagnosed mental illness or cognitive impairments. Next slide. The last slide that I'm going to go through is just to talk about Project Guardianship's approach, which is three-pronged. I've been talking mostly about our direct services and the clients that we serve, and we become, as an agency, their guardian. So we are always working to increase the number of clients that we can serve with our very high-touch service model. In addition, we provide training and education about guardianship issues and how to avoid guardianship. And we advocate for better services and better health outcomes for people that are either already in the guardianship system and also for people who may be at risk of becoming involved with legal guardianship in an effort to prevent the reliance on legal guardianship. I'm now going to pass it over to Azaleea and Deena to talk more about these second two pillars of our work.
All right, thanks, Kimberly. And hello again, everyone. Really glad to be here. So I'm just going to talk a little bit about the trends that we're seeing, and I'm sure that a lot of folks on this call are familiar with these statistics, probably seen them somewhere. New Yorkers are aging. We know this. I think these numbers speak for themselves, and you see, just how, this issue affects so many, regions across the state, so many of our clients and communities, an overwhelming majority of counties in New York, where a quarter of the population will be over 60 in just 7 short years, 51 out of our 62 counties. So there's 62 counties in New York, 51 of them will have a quarter of the population be older adults. The projected number of New Yorkers 60 plus in 7 years will be, over 5 million. Over 70% of these aging New Yorkers will likely need some form of long-term care And as we've also seen in the news, cognitive decline, dementia, Alzheimer's disease, and other neurological, dementia-related conditions are on the rise. So we really need to prepare for a state where our older adults will be, a greater percentage of the population. And like Kimberly mentioned, anecdotally, our clients are poor, but I think that we need to extrapolate and apply that to our state, holistically. New York is getting older and poorer, and for communities of color, these statistics will be even worse. Like the systemic inequities and barriers, and especially the poverty that they'll be facing, will be even more pronounced. So it is something that we really need to look at and prepare for. And I also want to mention that a lot of these older New Yorkers are, clients, communities, neighbors, loved ones, will be aging alone, living alone in their homes, and social isolation and loneliness, it's been shown in the data, increases the likelihood that they will be preyed upon by scammers, and will be, have an increased likelihood of being exploited financially, or have other, maltreatment, possibilities. So it is something that we really need to look at closely. And I think that, that when we're talking about older New Yorkers, there's this tendency to think of it as an us and them kind of dynamic. Like, we're fine, we're okay, we're over here, we're like, young and healthy. And I think that there's this disconnect in that, we are all aging. Like, as this seminar is happening, we are aging. And so this is something that is going to affect all of us. Like, I really want folks to have, one of the takeaways be that this is affecting all of us. This is not just something that, is a them problem. Because we're seeing these trends and we're seeing these demographics, Project Guardianship is working on, ways to improve the system and to make it more equitable, more accessible for everyone across the state. And I think if we go to the next slide, we can talk a little bit about, some of our recent accomplishments and goals. The biggest one being to reduce the reliance on guardianship. And, when all else fails, ensure that the people who really need the support have equitable access to a good, high quality, comprehensive guardianship provider. So a few years back, Project Guardianship conducted a broad research study with I think it was some academics at the University of Syracuse. Kimberly, I'm not sure if that's correct, but we put out a report called Incapacitated, Indigent, and Alone, which looked at kind of the inequities and barriers and obstacles facing older New Yorkers who are indigent. And as I mentioned before, don't have that support network of family or friends to help them as, their aging needs grow more and more complex. And because of that report thank you, Deena, for putting it in the chat. Because of that report, the Office of Court Administration, the New York State Unified Court System, was able to apply for and received a grant called the Elder Justice Initiative, EJI grant, to really think about how the court can improve its website, its legal processes and forms to make this complex issue a little less so for New Yorkers who might need this resource. Deena, do you want to say anything more about the EJI
Sure.
since you're spearheading so much of that work?
Yeah, so the court was able to get funding from ACL, the Administration of Community Living, and we're working on a whole bunch of things. One is that there's very little data on guardianship in New York, and this project's working on creating a new data tracking system that hopefully will give insight into how guardianship cases unfold, identify patterns, needs, outcomes. Project Guardianship specifically is working on a new guardianship website for the state court. And this will include new informational resources, including videos that are nearly ready, glossaries, charts, fillable plain language forms that can be used during the guardianship process. So many things that are really needed. And it's also going to focus on resources to help with pursuing alternatives to guardianship and what to do if you're having issues with the guardian. So it's really going to be a hub for a lot of different things. We're also, and this is very exciting, we're working with the courts on a survey, and the survey has had nearly 1,000 responses. And this was a survey to learn about the challenges experienced by court users and also the court staff in guardianship cases. And this group is actually planning a virtual event. It's being planned for October 25th, where we'll share the results of this survey, and we'll be facilitating conversations with people on how we can use this information to improve outcomes moving forward. We'd love it for you to attend. I'll put a link in our mailing list into the chat so that you can get information when the registration link is ready, because I'm sure a lot of you would have a lot to add to those conversations. Another thing that we've been doing is that towards the end of last year, Project Guardianship kicked off our Good Guardianship and Autonomy Preservation Coalition, known as GGAP. And this is a sort of broad-based multi-sector network brought together by us to exchange ideas, information, to create partnership opportunities between people, and really to increase services and analyze what's going on across the continuum of care, hoping to reduce the need for guardianship. And then, as has already been mentioned many times today, we're looking to ensure equal access to good guardianship when it's needed. We've had a couple of really great webinars since last fall. Of particular interest to this group, maybe 2 webinars we had earlier this year. One was on healthcare decision-making and another on planning for mental health crises. I think I saw some of our panelists here. Hi, and thanks so much. If you want more information about the coalition, I will also put a link in the chat to sign up for that and for any upcoming events. And there's also a very brief survey there if you have any suggestions on webinar topics or things that you'd like to see related to programming.
Great.
I'll turn it back over to Azaleea to go into our policy agenda.
Thank you. Yeah, so when I first joined Project Guardianship, I'll admit it, I was not very well versed on the issue. I did a lot of listening, researching, talking to people, talking to experts. Started to think about, what would be the best needs and intersectional needs or disability support and advance. And we came up with a couple after doing an extensive listening tour. The biggest priority, I think, for us right now is to fund good guardianship across the state in the nonprofit model. Like, we are really working hard to create a network of nonprofits around the state that will provide comprehensive, high-quality guardianship services for low-income people. So that is our #1 priority, getting a long-term sustainable funding stream and really making the attention and momentum it deserves, because as we just talked about, if we don't plan now, there will be a lot of people slipping through the cracks. So that is our #1 priority goal, policy goal. Then we are working with New York State to really create a home for this issue in our government. Right now, guardianship doesn't have a home. It's like split up among various agencies across the state that each have a little piece of the issue. There's aging, there's health, there's mental health, there's housing and community development, but there is not one agency that really serves as the hub for guardianship, because it is so interdisciplinary and so intersectional and really impacts and touches so many aspects of a person's life. So we're really looking to find that home. And currently it looks like it might be in the state office on aging, but we're still having conversations. We're still thinking through with our coalitions and experts about what would be best suited to really govern this issue. We are looking to create a database and to really start collecting good data across the state about who's getting a guardian, who is serving as guardian, why are they entering the guardianship system? And, Deena talked about this EJI reform project, and I think that that will be very, very critical in answering some of these questions around data. We're also looking to, better, support lay guardians, to really give them a lot more information and resources to assist them in their guardianship journey. A lot of guardians, most of them I would say, are family members, loved ones, people in the AIP, alleged incapacitated person's life. And we think that is the correct model, and that should be the, we should maintain that system for as long as we can for people that have those supporters in their life willing to serve in that capacity. And we just need to give them the resources and tools and information that they need to best secure the outcomes available for them, that would best serve the person subject to guardianship. We also want to promote alternatives to guardianship. Like Deena mentioned before, we think that prevention and keeping people out of the guardianship system is a really important goal for New York and our communities, because yes, while guardianship is a way to protect people and advocate for their best interest, it also does, take away some rights, and we want to, reduce that as much as possible. So alternatives like powers of attorney, healthcare proxies, advanced planning, anything that a person can create while they still have that capacity that will, make their wishes and preferences known for the future. We also are working towards improving oversight. And, there is still work to be done there, but I think that, with the Guardianship Reform Project, courts will have, better practices to utilize in overseeing the many cases across the state. And then additionally, lastly, we are also working on normalizing the termination of guardianship, or at least, making it not be a lifelong structure in place in a person's life. Like Deena said, like we were trying to get limited guardianship to be more of the norm, and that, hopefully when the person's capacity returns, when the health crisis is over, when they have recovered from their debilitating health condition, they can restore all their rights. So we're really looking forward to advancing all these goals, and hopefully some of the attendees today will join us in these efforts. We can move on to the next slide. So here I'm just going to talk about a few recent highlights. It's been a great year so far. We still have a lot of work to do, but recently we were able to secure the first ever inaugural New York State $1 million appropriation in the executive budget towards nonprofit guardianship. This is a huge win for New York because this issue finally got the attention it deserves, and the momentum and the funding that it deserves. And we can talk more about that later, what we're doing with this allocation that we're very, very thrilled to get. Most of the money went to our GPS helpline, which is our guardianship prevention and support helpline. We launched that in June. It's taking calls. We're serving clients around the state. I think it will be a tremendous resource for all New Yorkers, whether it's, advocacy organizations, other nonprofits, elected officials, health foundations, whoever wants to refer, thank you, clients, callers, please do. We can talk about it further later during this conversation. Like Deena mentioned, we put on a couple of webinars, and I think I saw Dr. Jacqueline Gamar on here before. I think she had to run, but she was one of our guest speakers, I think, in the Planning for Mental Health Crises webinar. Thank you, Dr. Gamar. We see mental illness impact a lot of our clients, and there is a lot of overlap in guardianship and mental illness. However, I do want to point out that a guardian's authority is limited in those really, really extreme mental health crises, and that guardians cannot cannot ensure compliance with medication, cannot force people to, to get mental health treatment if they don't want to. They still need to make that choice. We also had a really good webinar. I think I found it very, educational around, healthcare decision-making and planning for the future, and again, I'll say that, people think of this as like an older person's problem. Like I'll think about it, when I'm down the road, but, I want to take this opportunity to like give a gentle reminder that this can happen to any of us at any time. Like there could be some, some crisis, some accident, some unforeseen health condition, and I would really urge everyone on this call to think about that and make those plans for themselves, because we should think about that now while we still have the ability and the capacity to to voice our desires and preferences. We also recently got an op-ed published in the Albany Times-Union with one of our big elected official champions, Senator Kevin Thomas, and then Becky Prevey, who's the executive director of the New York Association on Aging, really making the case for nonprofit guardianship and why New York needs to fund this as a social service. We are also heavily involved in the New York State Multi-Sector Plan for Aging, the MPA. I'm sure a lot of folks on this call are also in those subcommittees or maybe on the Stakeholder Advisory Council or working on the subgroups. We are working to ensure that, guardianship, alternatives, and prevention is one of the main areas of the MPA, working to center the needs of older adults across the state to ensure that, New York actually lives up to its promise of being an age-friendly state. New York prides itself on being a leader and being a trailblazer. But we really need to ensure that the state makes the investments that, it is claiming to want to see happen. And then lastly, we are currently engaged on an environmental scan on decision-making supports for older adults, which is a big, very promising and landmark, I think, movement. And it is also a new section to the mental hygiene law. It's Article 82 that was just passed. However, we're still learning about the ways that supported decision-making can be best utilized in older adult populations that are that have some sort of cognitive decline or cognitive impairment. So we're very excited about that, and we look forward to sharing those findings with you at some later date, hopefully soon. I think we can go on to the next slide. Great. And how do we get to all these highlights? By coming together as a community and by forming coalitions, and really bringing leaders together to reflect the voices of our communities and also our clients. We believe that policy should not be made without, including the voices of those who are most impacted by the policies that we are working to create and advance. So, Deena talked about the GGAP Coalition, Good Guardianship and Autonomy Preservation, and their work, but we also got a group of, nonprofit guardianship providers and disability and elder justice advocates together. Hi, Jesslyn. I see you on there. Thank you for your efforts. Jesslyn is with the Center for Elder Law and Justice, and she has been one of the first members of our Organic Coalition, along with Lifespan, EAC Network, which is Empower and Empower, Advocate, and Compassion, Care. And Guardianship Corps, and Judge Diamond is also part of our coalition. And for those of you who don't know Judge Diamond, please find a way to get to know him, because he is such a leader and advocate and such a compassionate, former justice of the Supreme Court, overseeing the guardianship part in Nassau County. And Guardianship Corps serves in Nassau. They are part of, thank you, Deena, Empower, Assist, Care. Guardianship Corps has been single-handedly holding it down in our Long Island counties. So we created these coalitions, and then, we got the coalitions talking to people, talking to elected officials, leaders at the city and state level. We were at, basically every, budget hearing that we could get ourselves into. We were at aging, mental health, disabilities, health and hospitals. We did a big push around the budget earlier this year. We were talking to the heads of, NYSOFA, Department of Health. We hosted a lobby day where we were, virtually in Albany talking to, the chairs of these various committees, really making the case for why nonprofit guardianship should be a priority for funding this year. We also did a briefing for the city council at the local level, just really getting the conversations going, the communication, and I think that momentum has paid off, and in such a short time we were able to do so much, and I'm extremely grateful that we've gotten this far, and look forward to even more work together. And I think we could move on to the next slide. So yes, while our inaugural $1 million appropriation is a step, and we're very grateful and glad that we're able to secure that, it is just the beginning. We have a long way to go. We had requested a $15 million appropriation, but we'll take what we can get. We're very happy that we got that 1 million, and we're on our way. And I think that through all these collective efforts of the helpline, of building up the network, of the EJI project, the data collection, this will really help inform policy going forward, and will really underscore the need for this service and the need for New York State to create the infrastructure and serious, sustainable funding stream necessary to best serve our aging New Yorkers across the state. Deena, do you want to talk a little bit more about the helpline?
Yeah, so we're going to end the presentation portion of today's webinar by talking about the helpline. I saw some interest in the chat. That is great. We've been working really hard on it. This helpline just launched this past June, and it's free information and referrals really to anyone with questions about Article 81 guardianship in New York, or if you're concerned about someone living in New York. And I want to point out that this is for people in the public, but it's also for professionals as well. And we're happy to talk about even things that are very tangentially related to guardianship. Why this helpline? Our guardianship system in New York, we really rely on the participation of family and friend guardians, lay guardians. But until this helpline, there really wasn't any sort of adequate resource for those considering becoming a lay guardian, and there was nowhere really to discuss less restrictive alternatives to care for a loved one. And then beyond that, the spectrum of supported services, they can be confusing, right? Navigating that for your family. So professionals, including healthcare providers and social services and community-based organizations, and many other fields, are also constantly confronted with patients and clients who have guardians, or people who may need guardians, or families asking you all questions and don't have anyone to consult with or anywhere to refer clients and their families. Yes, Allison, you can refer clients to us. There's been really a shortage of information for people in this group. And so we have our helpline to increase access to information about guardianship and its alternatives and tangential systems. I've said the same thing so many times. I'm just really excited about it. So we're hoping that people will use this as a clear place to go with their questions. We've had a wide array of callers, from worried family to elected officials, hospital social workers. Some people are just overwhelmed with being a caretaker and want to talk out their plan and see if it's time for a guardian, or someone who wants to talk about less restrictive options because they're working with a client, talking about the court process. We get calls from people who already have guardians or know someone with a guardian who think there maybe needs to be a change or it's time for it to end and don't know what to do. And then we're also really building up our resources to be able to refer people to places if there are issues with elder abuse, if they're looking for a case management program, if they need information about financial scams, court-based resources. It goes on and on. Every call is completely different. And I think someone asked in the chat, yes, we now have the ability to take calls in, I think, over 120 different languages. And we can also do written translations because you can reach out to us by email as well. So we would just ask if you're referring someone to us who wants to have a conversation with a translator, that they reach out to us first in writing with the language that they want to have the call in, so that we can then set up a time for that. It's the easiest way for us. And speaking of how to reach us, so we have a phone number, we have an email address, and then there's also a web form on the website. We are taking live calls right now from 10 to noon. So if someone calls during that time, they can expect to, unless our staff members tied up, they can expect to be able to reach a person immediately. But we've been getting it back to people usually within 1 business day. We have voicemail set up, so anyone can reach out to us at any time. If you would like to know more, you can feel free to reach out to me directly. I'm happy to do presentations for you or your organizations. I saw someone just ask that. Yes, we do. You can reach out to me directly or any of us, and we can set that up. Not only about the helpline, but if you also want to combine that with a training on a related topic or guardianship, happy to do that as well. I am going to put our website in the chat and a shareable flyer in the chat as well. And here is our contact information. So you can reach out to all 3 of us. And those are our socials on Twitter, Facebook, and Instagram, if you'd like to follow us. And I think we're ready for the question portion. So I'm going to stop my share. There we go. Thank you so much.
Wow. Thank you. Obviously, this is a tremendous resource and a great organization. And thank you so much for this very helpful overview. Deena, Kimberly, and Azaleea. That helpline is a great resource. I'm so glad. And we'll make sure to post it on the webinar follow-up information that will go out as well. So clearly, not only are you guys doing great work, but it's also a very robust community represented in the audience here. There's quite a lot of movement going on in the chat. So great to have that here. And then also I wanted to congratulate you on securing the funding in the budget. So I know that's not easy to accomplish, and it's a tremendous start. So we've had some questions coming in from the audience. I'm going to try to incorporate that. Not everyone may have seen the questions and the responses in the chat, so I want to try to pull that into this Q&A. But let me just start with first an observation and then a question. And you may have already kind of, you touched on some of this already, but I think it's worth sort of underscoring. It does seem to me that the whole process of guardianship requires a certain level of comfort in understanding how to navigate a legal system or a complex web of different systems, and like a comfort in a knowledge of English, a high level of literacy, for example. So it may actually leave out a whole swath of populations like non-English speakers, undocumented individuals, people with low health literacy. How are they affected by public guardianship, and what are you guys doing, or what are the different ways that the different networks are able to provide support for those individuals?
I'll jump in first, but then I invite Deena and Azaleea to also answer. You've hit upon one of the equity issues, which is the ability to petition for a guardian can be very expensive and difficult. And so some people who may need a guardian might go without for that reason. The easiest way is to hire an attorney to do the petition for you. But if you can't afford that, you are able to put on a petition pro se, but it's incredibly challenging. The paperwork varies. We're working with the courts right now to put more information out there and to have uniform forms and processes throughout the state. So that's in process. But even everything we do to make it easier, you're still having to put on a case and make an argument for why a person needs a guardian. So it is very difficult to do. There are some limited legal services around the state that will help folks pro bono with guardianship petitions. And there used to be some sliding scale fee programs as well, but I don't think those exist anymore. So it is a real challenge of access to guardianship petitions.
Yeah, and it seems like public awareness is obviously a key when it comes to this topic in general, and knowing about the hotline and the work that and the services that you offer is also helpful. Given just some of the limitations. There was a question that came in about, do you know of similar organizations in different states or ideas for how to begin navigating public guardianship outside of New York State?
So I'll take that one. If the question is, if someone's working with someone in another state who has a family member in another state and they're concerned, we are familiar with some programs in different states from, going to conferences and just sort of being on the national scene. And we have gotten calls where the issue was in other states, and we do our best to link those individuals with our contacts in other states. There aren't organizations quite like ours in other states. They're doing all sorts of different things. There aren't, helplines and things like that in that many states, but there are organizations that are doing some level of supportive work.
Yeah. And in terms of the theme around challenges around accessibility, someone in the chat had said that, in working with a medical legal partnership, that is very challenging. Physicians in particular have a hard time filling out forms, and it just makes it, puts up more barriers to full participation and collaboration with different stakeholders. So another question that came in is, can anyone be assigned a court-appointed guardian? What if you don't want one? What about public health proxy or power of attorney? This is a question that was sent in by text. What do you guys think about this? Does a person have a choice in the matter, or is it like a done deal? Are there options for them to get around public guardianship?
The person who's the subject of a guardianship petition will be appointed an attorney who can argue the alternative case that they don't need a guardian, but ultimately the judge decides. And so it does come down to the statute and what the law provides, which also very clearly Article 81 states that the guardianship, as Deena stated, needs to be the tool of last resort. So the judge should be making sure that powers of attorneys and advance directives and all other both social service and legal tools have been exhausted before the judge deems that the person needs a guardian.
Okay.
And there is that legal threshold. There is this evidentiary burden. There has to be testimony. There has to be documentary evidence. It is a legal hearing. It's a trial, really. And the preponderance, it's not even the preponderance of the evidence standard. It's a clear, convincing standard. So, it's almost like beyond a reasonable doubt. It's not that high level of like, proof, but it is very high threshold. So once that decision has been made by the judge, the only avenue really is appeal.
Yeah. And so a question also that I have is if you could share one or two very practical tips for the audience members who may have family members or loved ones in need of a guardian, a publicly appointed guardian. What are some of the things that they should be aware of or think about as they're kind of approaching this this topic? And then as a follow-up, what about local organizations or CBOs, faith-based institutions? What can they do to sort of what role can they play in helping to make sure that there's the relationship is set up for success in a way?
I'll provide one tip and then I'll pass it over to Deena and Azaleea. The one tip that comes to my mind, both for families and for institutions and human service agencies, is to be willing to talk about aging and our needs, and to not avoid the conversation, and to start that conversation as soon as possible, because the more advanced planning and the more thoughtfulness, the better you're going to be able to address the needs of the person. And I would recommend to anybody to do everything you can to avoid guardianship, and really the way to do that is to not wait until it's too late, not wait until there is a major problem that can't be addressed in any other way. Oftentimes, guardianship will be needed because it's too late for a power of attorney. Let's say somebody had a stroke and they no longer have the capacity to enter into a legal agreement, but somebody needs to pay their bills and somebody needs to be able to make decisions. And so guardianship becomes the tool because it's too late. And so really the advanced planning is really key. And I will again say that I think our public institutions and our social service and human services networks can help people have those conversations. And so it's not just individuals, but the service providers as well.
And also in terms of the question you asked related to tips, not to do another plug for our helpline, but part of the reason that we created a helpline is because until then, it was very hard to be able to send someone to a place to be able to talk to them in the moment of, does my mother need a guardian? Does this person that I care about need a guardian? That the information isn't really all in one spot or readily available. So not only, Kimberly's tip of talking about it early, so maybe you don't have to get to that point, but like being able to have someone to talk to about whether or not the person needs a guardian or understanding what guardianship is. But we get a lot of calls actually where once we're talking through the person's situation, it turns out the person that they care about isn't necessarily incapacitated. It's that the family caretakers just haven't been given the information that they need in order to take care of them in a way that feels good for everyone. Mm-hmm. And so it's like lots of talking that needs to be done. I know sometimes people say, oh, so much talking, but there's so much out there. There's so many resources out there. And you need to be comfortable talking about these hard things to know what's available, so that, again, as we mentioned, you can avoid guardianship if you don't need one, but then also, we're there to help talk you through the process to a degree if you do need to start one.
Absolutely. So
I think sorry, can I just
go ahead.
One quick thing. I think what Kimberly said was really important about combating ageism. I feel like we as a society have a long way to go in talking about like the ugly stuff, the dark stuff, the sad stuff. Like we need to talk about who's going to take care of us. Who's going to take care of you? Who's going to take, like what systems and structures do we have in place? And what do we have as a society, socially? How is our state looking out for us? Mm-hmm. And how are we all going to build something that is worthy of New Yorkers, that will be there, equally and well resourced for everyone in case there aren't people, to support and to provide that care.
Well, thank you. And so really last thing before we do have to close out, someone had mentioned elder justice projects in the courts. Any upcoming events that you want to let our audience members know about?
So I think that I briefly mentioned it, but I know it was maybe buried in a lot of information.
You get one final plug.
Yeah, great. So yes, we had a survey that went out in the winter, asking stakeholders, anyone who's really involved in guardianship in any way around the state, to talk about challenges using the guardianship system, using the court system, and also the court's perspective on the challenges that they have and the challenges they see. And we had nearly 1,000 responses, so much good information. And we are, through that project, working on analyzing the data. And on October 25th, we'll be presenting some of the preliminary findings and having an interactive virtual program where we'll be splitting up into groups and having guided conversations on, now that we know this, what should we do now? Like, how can we take this information and move forward? What's needed? It's great to have information, but now that we have it, like, let's do some good with it. And so we want to be able to hear from people, both around the state, but like coming from different perspectives and different sectors. So I had put a link in the chat a while back about how to sign up for our list so that you can get an email about it. But we would love for any of you who would like to attend to come, even if you didn't fill out the survey. The more people, the better.
Absolutely. Thank you, Deena. And so obviously there's a lot going on in the chat here. It's pretty much blowing up, but unfortunately we don't have any more time. So we are going to have to wrap up for today. Obviously it's a very thought-provoking topic, and we encourage everyone to take a look at the Project Guardianship website for a recording of their previous webinars. The helpline is a great resource. And obviously, we're all walking away with some practical tips that we could share with others. So I want to thank Kimberly, Deena, Azaleea once again for all their sharing of all of their knowledge and for their sharing of their time. Thank you all. And special thanks to Erica von Boxtel from our communications team for her work behind the scenes on this webinar. And thank you, our audience, for joining us. A recording of this session will be posted on our website. And also, I want to encourage you to check out information about our next webinar, which will be on Thursday, August 17th from 1 to 2 p.m., where we will focus on the end of the public health emergency's impact on telehealth and its implications to patient access. And so I hope that you can join us. Once again, thank you for your time, and have a great afternoon.